Welcome to another episode of The Patient Voice Amplified. I'm Adam Cherrington.
And I'm Dan Czech.
Thanks for joining this episode. We're happy to continue the conversation and talk about how can we listen to patients more in healthcare IT. So, Dan, I'm really excited about today's episode. We've got someone very passionate about listening to patients and health equity. It's Dr. Kikelomo Belizaire, Dr. Dayo, Chief Medical Officer of Pegasystems. So we're in for a treat today.
Yeah, this is exciting.
Thank you, Adam and Dan. Thank you so much for having me. I'm so excited to join you today.
Pleasure. You and I have not known each other a long time, but as we started to talk, it was very clear you've got a unique passion for health equity and patients, and it was a very easy decision for us to invite you to come. So thank you for joining.
Absolutely. Glad to be here.
Tell us a little bit about yourself, your background, your current role. How did you get to where you are today?
So as you stated, I'm Pega's Chief Medical Officer. I joined in March of this year, March 2022. Previously, I worked as a medical director at the second largest healthcare payer in the States. I'm an acute care physician. I'm boarded in internal medicine. I've practiced almost 15 years by the bedside. In fact, I continue to practice, and that's because my passion is and always will be the patients that I serve. So it's interesting that you asked what brought me to Pega. I have a background in public health and healthcare consulting, but I joined Pega because of their focus on improving patient outcomes, and that in itself will also help me broaden that individual impact on a more global level, because over the last several years I've seen so many inequities, so many disparities across healthcare, and I saw where the fractures and silos are, and I'm also seeing what we can do to improve those through technology. And so I'm hoping to use my experience to provide a holistic lens and approach to solving some of the industry's most challenging problems. I think from a macroeconomic perspective, as an industry leader and with knowledge about the upstream drivers of the challenges that we're facing, as well as the microeconomic perspective, being on the front line, that will arm me with enough information to be able to be part of the voice that speaks up to the solutions that we need to bring to the table. And my charge is to leverage sophisticated revolutionary software that's AI powered to address the needs of the patients and to simplify their journey. Because very recently, my own father experienced a pretty horrific healthcare journey, and I really remember stripping off the cloak of being a doctor and having to jump ship and become a patient advocate, a physician. Not everybody has a physician in their family, nor should it be a requirement, but it is. And I think that really opened up my eyes in regards to, being more vocal and to also being finding the answers to be part of that solution.
Well, I love that service first mentality and absolutely respect that. I'm sorry to hear your father's gone through a challenge like that. And what else in your background has led you to this goal of equity and serving the patient in the way that you've described?
Well, COVID certainly uncovered a lot of those inequities for us, right? I just didn't know that it was so deep in the way that it ran, all the way from some of the biopharma technologies to the medical devices to the diagnosis of patients. I think what I've seen, in terms of health inequity is that while we're seeing a movement for it, not all stakeholders are at the table. And that's very imperative. We need all stakeholders to be there so that we can make a collective decision, so we can collaborate on what our shared vision and goals are. And so, I mean, everybody needs to be at the table. I think that we need a cross-functional collaboration on health equity initiatives. I think that outlining those strategies and identifying it, confronting it, and providing solutions to the root causes of health inequities is going to be instrumental in regards to moving that needle forward.
Are there any specific actions or initiatives you're leading to help bring all of those stakeholders' voices together?
What we're trying to do, on our level in terms of technology and Pegatechnology is to be that orchestration layer to, one, identify the social determinants through various means and mechanisms, such as patient assessments, any direct conversations or EMR documentation, so we can identify them. And then we're also using our technology to prioritize those social drivers. Because, for instance, if a patient has difficulty with transportation versus food insecurity versus a need for emergency housing, which of those would you like to solution first, right? The emergency housing. And so we're prioritizing it, and then we're working to resolve them by helping care navigators identify the appropriate interventions and resources to help mitigate them and resolve those barriers to care. But to your point, Dan, I think that in addition to that, there's more that needs to be done. We're only part of the solution. It'd be really quite foolish of me to think that that's the whole solution, because I think that implicit bias training programs need to be built within the medical school curriculum. I think that increasing partnerships across agencies involving clinical, community, social services, federal and public health sectors, that needs to be done on a deeper level. I think the medical community needs to regain trust of our patients. And I think that we need to develop a sustainable community-driven strategies and solutions together. And I can't underscore that enough. We need to do it together.
I love that imagery of getting all the stakeholders together to have the conversation, but also make the plan of action. And what a wonderful idea to start in the medical schools. I don't think enough is discussed that early in the career of clinicians. And what a great idea. I love that concept.
Thank you.
What else are you seeing in healthcare that's working to involve patients? Whether it's listening, we hear often about patient family advisory councils or PFAC. Anything practical in play today that you're seeing that's working?
Well, some of the technologies I've seen is the increased usage of patient portals and telehealth visits. I think those have been a great starter to increase the transparency in patient engagement and to really amplify their voices. But while those two methods are great starting points, additional technologies and avenues in medicine need to be utilized to involve the patient in their care to further amplify their voice. And a lot of patients, in my career, they're more comfortable at home, let's face it. So with the rise of this healthy at home, I love it. I love it because it is tailored for them. They are in their environment with their family and getting the same care, if not better. And so I'd like to see where this takes us, because we're seeing great results from it, like decreased readmissions, the patients building up increased trust, the patient being more comfortable with their providers. And so I think, with IoTs, with healthy at home, we're headed in the right direction, because at the pace in which we're going in terms of healthcare per capita in the US, it's unsustainable. So we're going to have to be creative in ways to care for patients, listen to patients, and collaborate with patients.
Oh, I love that. It's almost like a Back to the Future of the doctor making the house calls, right?
I love that you talked earlier, one of your drivers in your background was really focusing on the patient outcomes. And as you talk about health at home and some of those initiatives, you talked about some outcomes that are really patient-centric, and that's not always what we hear with patient engagement technology. You talked about reducing readmissions, but the patients building trust, the patients being more happy as they recover at home. As you partner with some of your customers or others that you work with in your experience as a provider, are there other technologies you're seeing that really amplify the patient outcome rather than the organization's outcomes?
Yes, I'm so glad you asked us that. But before I answer that question, Dan, when you amplify the patient's outcome, you automatically amplify that organization's outcome, because there's a financial repercussion to go with decreased patient outcomes. And it is not just that organization that faces that burden, but society does too. And so it's important to pour into our patients, pour into those outcomes so that we can all benefit. And so I like what you said. And, I find that in my career that oftentimes as providers, we're either talking at the patient or we're talking to each other about the patient and not talking with the patient. And this disconnect renders them voiceless, and it precludes them from being part of the conversation. We have to get away from segmented and reactive outreaches to our patients, and we need to focus on personalized, proactive engagements. So in my humble opinion, I believe that we can amplify the voices of the patients by, one, I can't echo this enough, building trust; two, having meaningful engagements; three, improving health literacy. So let me share some of the ways that we achieve this at Pega. We have something called a center-out architecture approach, and that places a keen focus on the patient by putting them in the center of the technology and integrating across disparate sources so that you can be provided with a 360 connected view of the patient, and enables our customers to be able to orchestrate actions that achieve better outcomes because they're looking at the whole patient rather than the partial. Another thing that we do is something called next best action, and that capability uses artificial intelligence, machine learning, and predictive analytics to identify unique patient needs and preferences that is specific to that individual in real time. Not yesterday, not 30 minutes ago, but in the moment. And so that's exciting for me because knowing what I like, when I like it, how I like it now is relevant to me. And so that ensures that every engagement is also relevant, meaningful, and builds connection within each and every interaction. And so when you couple that, you start building trust. And lastly, I'd like to say we have a care management application that sits on top of a unified platform to help deliver a patient-centric approach. And this enables the care navigator to focus on care delivery, to engage and educate the patient, to coordinate services, connect care teams, and enroll the patient in personalized programs so that their overall health and wellness improve. And so, as you can see, within those three separate descriptions that our technology espouses, all in the center of that is our patients. And that's why I am so proud to join a team and join a company and be representative of what we're doing in healthcare.
Well, Dr. Dayo, it's clear we need about 4 more hours together. So can you open up your schedule? Is that a problem at all? My goodness, what amazing ideas. And I want to go back to something you shared. I want to celebrate what you said. as we amplify the patient and focus on their outcomes, we automatically focus on the outcomes of the organization. I think that's the harmony that we need in healthcare, because so often it feels like it's one or the other, to your point. And Dan and I have taken research calls where people say, hey, we know this is working, but our admissions are down, and that's a financial burden. So we have to stop the thing that's producing outcomes. And what a sad statement that was when we've had some of those calls.
Yeah.
So really love your perspective on that. Can we ask you, what advice would you give our listeners, those that are really seeking to harmonize patient outcomes and needs of the organization? Any other advice you'd give?
There are a couple, and the first that comes to mind is strip away any preconceived notions or bias that you have towards the patients. I think what we first have to do is admit that we have implicit bias, right? But we need to work to resolve that and see the patient for who they are and not a number in line. We need to be present. Oftentimes we're distracted because of our time constraints. We're typing as the patient is talking, or we're collecting some other kind of information. We need to be present in the moment, look them eye to eye, and listen and engage. I think that we need to speak and listen with empathy. Oftentimes when we're talking, we interrupt. We need to pause, and we need to be mindful and be empathetic. And this is one of the biggest lessons I've learned in my career. And it's so funny because patients think I'm a genius, and I'm really not. What I do is listen. That's all. And it's so striking for them to be like, oh my gosh, how'd you know? Because I listened. And so patients know their bodies, right? And so they'll tell you everything. All you have to do is understand the pathophysiology behind it and then render the diagnosis. And that's it. Half the times I challenge myself because of my medical school attendings who were brilliant. In fact, one had the name of the human ultrasound. So I challenged myself not to use tests and diagnostic tools to diagnose the patient. I wanted the patient to be my roadmap. I wanted the patient to be my way of diagnosing what was going on with them. So I would auscultate, I would listen to their heartbeat, their lungs, and so forth. It was really just the patient and I, and just listening to them. I'm telling you, I can't emphasize how that improved my clinical acumen. So I would say that's what I would encourage providers and staff to do out there. And don't be dismissive. Don't be dismissive. It breaks my heart when I see some of these stories out there that a patient had stage 4 cancer or had a severe illness, but they went to the provider maybe a couple months or years ago, and it was just dismissed because of their age or because they didn't fit the mold. But not everybody's textbook. And I don't want to put this just the burden on the shoulders of the providers, but if you're asking really in truth, what I think that we should do is listen and do it empathetically.
Fantastic. What a great statement. And we want to express our appreciation for your passion and leadership and what you've shared today. This has been a fantastic episode. And Dr. Dayo, thanks for what you're doing. We look forward to learning from you more over the next several years, and look forward to serving you and your team. And just appreciate what you brought to the podcast today. Thank you so much.
Thank you, Adam and Dan. And if I might say, I want to thank you personally from my heart for being that voice for the patients, for being their advocate, because it means a lot. Because as they're going through their medical journey, oftentimes they feel alone. So to create this and to be their voice and to educate our listeners, I can't tell you enough what that means. So kudos to you too.
Thank you.
Thank you. That's kind of you. Well, we wish you the very best, and thanks again. Loved this episode, and we're cheering you on. Thanks for what you're doing.
Thank you.
Dan, what a great session with Dr. Dayo. Learned some great things today in that episode. What jumped out to you? Anything you want to share?
Yeah, I really liked her perspective on how complex healthcare can be sometimes. And I remember she commented on the need for a doctor to be present almost in the patient's journey. Excuse me, let me go back.
Yep.
She commented on the need for a family almost to have a doctor as part of their healthcare journey, just to navigate the complexity of healthcare and the different technology touch points. Isn't that interesting how complex, even from a physician's perspective, healthcare can be?
Yeah. I mean, we've talked to CIOs that have said, I can't even navigate my own health system, and I know all the stuff that's connected or not connected, and as it may be. So yeah, hopefully we can help our listeners and others get past that a little bit. One thing that jumped out to me was when she said, we need to eliminate the bias of preconceived notions about the patient. And doesn't that go to the heart of truly listening and making sure that just because we are patients, just because we've been in healthcare does not mean we know what this patient needs or a subset of patients.
Right. And we're working with people at the end of the day. Every patient is unique. They're going to come from a different background, have different conditions, different experiences with technology. And I know it's not scalable to have a different experience for every patient, but certainly the way that we interact with them and the offerings that organizations give to these patients can be adapted to their unique needs.
I think you're right. In a future episode, we should hit more on health equity. I mean, that's come up with a few of our guests, right? But certainly the pandemic has really called that out in healthcare, how much of a disparity there is. So we'll talk more about that.
Yeah, I know we're getting ready to kick off a study actually on that topic, DEI and inclusivity in healthcare. So that'll be fun to see the results of that.
That's great.
So Adam, you just got back from the Becker's conference that was held a few weeks ago. Tell me some of the takeaways, some of your key learnings from that conference.
Yeah, really good conference. A lot of emphasis on consumerism, digital health. I was pleasantly surprised. A couple of our provider friends were on panels, which really drew me to the meeting. Really rich, interesting commentary from quite a few provider organizations. Some of the themes I heard, one was about price transparency and how we're not really there yet. It smelled like meaningful use, Dan. It was a lot of comments about, hey, yeah, we know we need to do this. It's easier to pay the fines than to actually fulfill what's required. And I think providers want to comply. They want to serve patients. They know it's important. It is a mess, though. It is so complicated. You think of the things coming in from the payer side and different locations and procedures and coding. And I really feel for our provider friends. They've got a hard job there. But it was a little disheartening to hear, hey, we'll just pay the fine. It's not there yet. So I think the jury's still way out on price transparency from the patient's perspective.
Well, we experience that in other industries too. I always love when I order food from DoorDash and don't get the bill until after my food arrives. I say that in jest, but it's interesting. Other industries have, they've broken down some of that supply chain challenges that exist in healthcare, and you know what you're paying up front, and at the end of the day, whatever they have to pay their cooks and their wait staff and those that prepare the food may be different, but you know ahead of time what you're going to pay for that meal.
And patients, consumers are totally clamoring for that. Another theme that came up I want to share is just the idea of all the noise in digital health. There's still quite a few solutions out there that are coming to providers. They're still trying to sort through that. A lot of providers talked about the need to have a more clear strategy and establish a plan around digital transformation and digital health. So I think that's a theme we've been hearing the latter half of 2022, and I think that's going to continue. Sometimes you and I talk about at the beginning of the pandemic, it was ready, fire, aim, right? It was just grab anything you need. And I'm grateful for those organizations that did whatever it took to help us as patients. But now it feels like it's a little more thoughtful, a little more deliberate. It's ready, aim again, and then fire is what it feels like.
And certainly as we step into a potential recession, I see a lot of wisdom behind that type of approach to make sure as we're spending dollars in the healthcare industry that they're the dollars that make the highest impact for patients, for clinicians, and all those involved in the healthcare experience.
Yep. Awesome. Well, we want to thank our guest again today, Dr. Dayo, for fantastic insights. We appreciate her time and wisdom. And we invite you to subscribe to the podcast. We want to thank our classmates and especially our producer, Jeff Peterson, who makes this podcast possible. If you have ideas for future episodes or find something you want us to look into, please send us a note. But thanks for listening.